So if a patient goes to you and they're wearing a denture, what are their options when it comes to dental implants in your practice?
So you mentioned dentures, right? Dentures have been around for a very long time. We think of George Washington had dentures, right?
Yeah.
300 years ago. It's a pretty ancient treatment option, right? We're looking at now, with the modern technology we have, the newest trend in dentistry is dental implants, right?
Okay.
And we can take the dentures and make them so that the problem is they don't have anything that they are holding on to, right? They're kind of just in the mouth. Sometimes we use denture adhesives and all that gunk to hold them in place, but it works sometimes. Other times it's not that great. And so with these dental implants, it gives the denture an anchor. Now it's still a denture, but you can snap it in to either 2 implants on the bottom or 4. You can do at least 4.
Just snap it in and snap it out.
Snaps in and out. It's still a denture. You're putting it in your mouth, taking it out at night, but while you're using it during that day, it's stable. It's not moving around as much. It's, you don't have to worry, and it does increase your bite force. Okay. And so this is important when you're eating every day and when you're talking, when you laugh and sneeze, and you don't want that thing to fly out, right?
Okay.
And so that's one option. The second option, which is a much better option in my opinion, and something that people are so much happier with when they choose this option, is as little as 4 implants with a full arch of teeth, a permanent fixed new beautiful smile. And this is done same day. Okay, so you come in the morning, you leave at the end of the day with a new set of teeth that's not able to be taken out.
But what about the upper?
Same idea. 4 implants, or screwing in a beautiful set of new teeth that you can smile with. And these teeth have the same bite force as your natural teeth. Matter of fact, the material they're made out of is actually stronger than your natural teeth. So you go and eat whatever you want. Go eat that steak you've been missing out on, okay? Now, both options work. So the reason that we really like these fixed teeth, the ones that stay in place, is you don't have to worry about it. It's not something that you're constantly taking out at night. Snap-in dentures work great, but you're still thinking about, I gotta take this out, put this in. That fixed arch is in there. It's not able to, you come and visit me every 6 months, every year, just to make sure things are healthy, things are staying clean, and we check and make sure there's no issues, and that's all.
How old can you be? I mean, could you be 70, 80, 90 and do this?
You can be, I've seen patients in their 90s. I've had colleagues do patients in their hundreds. This isn't,
the implants
no
aren't more likely to fall out?
We see 90-year-olds sometimes with better bone than the younger ones. No.
Okay.
Implants, once they're in the bone, they heal very well. They become part of that bone. They're fixed in there.
So age is not an issue?
Not an issue at all.
Yeah, but this has got to be true, that if you've been wearing a denture like 15, 20 years, you don't have enough bone to do this. Is that true?
Not true. Not true. Now, some dentists may have told a patient that, and that's because technology wasn't that advanced in the past. They might have looked at 2-dimensional images, and we do 3D scans, CT scans. We look at all of their bone density, we consider everything, and we also build bone. We build bone back. These patients, they've lost so much, they don't want to lose anymore. And when you're able to give something back to them, that's the game changer.
And we should mention, I mean, you have taught implants. You manage one of the largest implant centers.
Yeah, so I was.
So you have a lot of experience in this, is what I'm saying.
Right, and I've worked alongside other doctors. I've traveled to different clinics, and we've worked on cases together. I've seen the good, I've seen the bad, I've seen the ugly. Okay. I've seen it all, and it's actually, as much as I was teaching, I was able to learn some of the issues that came up and take that back with me and realize what we can do to avoid this and make sure that the procedures that we do, they're predictable and successful, and at the end of the day, that patient walks out way happier than when they came in.
Now, when you tell me what takes some other guys 10 months to do, you can do in like as little as 2 or 3 visits.
Exactly.
Why? What are you doing this differently?
We've got everything in-house. We've got an in-house, state-of-the-art dental lab with a dental technician there.
So you're making the teeth right there?
Right there. You're not talking about, traditionally, people are taking impressions. They're sending it out of state or out of country, maybe to China. And somebody that's never seen the patient, never seen their lips, their gum line, everything. They don't see all the details that it takes to make this right. And so a lot of people end up with dentures that aren't very pretty. They're not aesthetic, And so with our clinic, we're able to bring them in. We look at things, we take photos, we take x-rays, we design it, we bring the lab tech, and we sit down. Me and the doctor and the lab tech, we sit down and we talk about the case. I tell him, look, this is what I see, this is what we want to do, and he says, okay, I want you to do this for me, and we work together. It's a team, but it's all in the same place. You're not having to worry about going to this specialist for something and go to that specialist and different offices, different opinions. You know,
Good.
You've heard too many chefs spoil a soup, right?
I mean, nobody likes going to the dentist, so that's why you're able to do it very quickly.
Absolutely.
Because it's all done right there.
We can do it as little as 1 day. Some of the more severe cases, a few days. But yes, relatively really quick.